I'd like to introduce our last speaker, Robert Akins from Nemours Alfred I. DuPont Hospital for Children in Wilmington, Delaware. He's going to be speaking on neointimal hyperplasia after carotid resection and anastomosis surgery is associated with degradation of decorin and platelet-derived growth factor signaling. Dr. Akins.
Thank you very much, and thanks for the opportunity to present. I'm actually at the Nemours Children's Hospital in Wilmington, so pretty close to one of our moderators here. And I'm the center director where this work was done. Roshan was the clinical fellow, surgical fellow who developed the model that I'm going to talk about, but he's back in clinical training at Vanderbilt. But this is a lot of his work. And this work exists in sort of a continuum of studies in my laboratory, trying to address interventions, surgical interventions to improve post-surgical outcomes. We use a rabbit model for a number of reasons, largely having to do with the structure and sort of physiologic function of the adventitial tissue. And our overall goal is to be able to deploy sort of abluminally at the adventitial surface of skeletonized arteries, a synthetic pedicle. So this project is part of an ongoing set of projects involving rabbit. And what Roshan really looked at was the development of the rabbit model. And I thought we only had one slide, so I put what I could on one slide for this presentation. So the figure, the first figure is actually just showing the model that he developed. And this was a lot of work. And he developed a number of surgical models. And it's in A, it's the right, we use the left common carotid artery, and rabbits are about between 2.8 and 3.5 kilos, so relatively small vessels. And the left side, the common carotid artery is transected and then reanastomosed, and then followed with ultrasound to make sure that there's flow through the anastomotic site. 21 days after the surgical completion, the animals are sacrificed, and then we do a series of studies trying to look at the genesis of animal hyperplasia, which was not unexpected, but then linking it to pathways that we can address with some of our interventions going down the road. So what we found, what Roshan and the group found, was a distinct increase in animal hyperplasia measured at the level of the anastomotic site. Those are the H and E's and C and D that you can see here in this first part. The upper is the left common carotid, and the lower is the contralateral right common carotid from the same animal. So we used contralateral controls in this study. And then the column graph across the 5 animals that were included in this set of studies gives you an idea of what they're all significant increases in intimal hyperplasia across all 5 animals. What we're really interested in is whether or not a pathway, which is described actually by Dr. Martin and alluded to by some of the other speakers, involving decorin and platelet-derived growth factor receptor signaling in MMP2 was associated with intimal hyperplasia in this animal model. And really what we're starting to do now is intervene in this pathway using the model. So the immunofluorescence images that I'm showing are red, green, and blue. The green is autofluorescence of elastin. The prior speaker actually talked about the elastin laminae. The blue are nuclei, and you can see just from a quick look that the total magnification on the screen is a little bit different across the 3 images. That's because of the way these images were pulled from the paper. And then the red is 3 different markers with an indication of the lumen, the intima, the media, and the adventitium by LIMA. So what we found, in addition to this increase in intimal medial thickness, was an increase in decorin. And on Western blot analysis, the decorin was actually fragmented in the operated side, indicating a significant change in the decorin, not only the amount of decorin, the location of the decorin, but also the nature of the decorin moiety. There was an increase in matrix metalloproteinase 2, significant increase in the intimal, in the hyperplastic zone. And then phospho-PDGF receptor beta was upregulated in the intimal zone, as was phospho-MAP kinase. So the pathway that was illuminated by this links the animal hyperplasia in the surgical model with decorin degradation and signaling through the PDGF receptor beta pathway and MAP kinases. So the progression from here, and actually a number of the things that were discussed and that we're looking at, although COVID's really slowed down some of this research, as has Dr. Cruz going back to clinical training, is trying to parse out what are the interventions that we could use and to what degree sort of the chemical and cytokine signals and the activation of the smooth muscle cells can be controlled in the animal model. So we have data and that's going to be presented in meetings coming up, linking those pathways all together with potential interventions with our abluminal approach to providing a synthetic pedicle for skeletonized and operated blood vessels. So we think there may be therapeutic targets within that pathway and that this model will allow us to interrogate those pathways with some ease once we can get everybody back into the veterinary ORs to do some more preparations. This work was supported by R01 to me and a number of other funding sources, including from the Nemours Foundation, where I work. Really I just want to mention his name one more time. Roshan de Cruz did the Herculean job of building the model, getting it to work and getting the surgical approach to work. These are relatively small arteries. The scale bars in those H&Es in the first and the left side is C and D. Top one's 400 microns and the lower one's 200 microns. So this was a non-trivial exercise to get this up and running. So that's the gist of the paper. I am happy to talk about any details or about how these pathways might be integrated through the systems that we're looking at and how things are building together within laboratory using the rabbit animal model. But thank you very much.
So just a quick technical question. So when we do carotid endarterectomies, a lot of times we remove a portion of the intimal medial layer, which is supposed to also stimulate intimal hyperplasia. In your model, you mentioned that you deliberately try to touch the endothelium as little as possible. So how do you think that this model would, will relate to the actual clinical arterial intervention?
It's a great question. And the idea, which I'm happy to discuss, is that we're trying to separate what's a super complicated set of pathways, interacting pathways. So the sort of inward out, intimal to medial signaling, we understand that a little bit, I think. And from Dr. Martin's review, there's quite a bit that we might know about that. Something we don't understand as well as a community, I would say, is outside in signaling, or signals that propagate from the adventitium back through the media to the intima. So to answer your question specifically, I'm not sure how directly it reflects on common surgical procedures, but what we're trying to do is develop the model so that we can test different aspects of what's going on. So these are just transected and then reanastomosed as one of multiple different surgical models that we work on in the laboratory with limited disruption, so that if there are, which we think there are outside in signaling pathways, that we have a model system that we can address those. But it's a great question. We can do that, but in my mind, I'm not smart enough to parse out all of that information that might be going on if we disrupt the endothelium as well.
So I'm just going to relay Dr. Dardick's question from the chat. So what are the advantages of this rabbit model? Should it be more widely adopted?
Those are two questions. So the advantage for us is an early interest of mine in adventitial physiology, and the vascular adventitium and the carotid artery of the rabbit is much closer to what's in humans. So we were really looking at activation of adventitial fibroblasts early on until Roshan came in the lab with this kind of study in mind. And we can't do that in smaller animals. So the big idea was that the rabbit is small enough, not super expensive, not all the way up to porcine or canine models, so that we could crank out a number of surgeries. So in that sense, I think it is a very good model. It is a tricky model. The vessels are still small, even the carotid's not for the faint of heart, getting in there surgically. And some of the genetics and some of the probes that other labs are able to deploy fairly readily are difficult in rabbit. So I would say it is well worth using, but to really understand what the model's strengths are. And Dr. Tang asked the question about, well, we don't disrupt the intimal layer because we're really trying to understand that adventitial influences on animal hyperplasia and on the pathophysiology in the vessel wall. So yeah, if anyone's interested in using rabbit in the lab, I'd be happy to talk to them about our learning curve over the few years that we've been working with them.
So Dr. Hedin had a question about whether you see the same effects on decorin in a regular balloon injury model as opposed to transection and reanastomosis.
Yeah, I think in other studies, we haven't looked in our lab, but in other studies, the expectation is you see similar pathways in a balloon, sort of damage based on distension of the blood vessel from a balloon. So we weren't surprised that this pathway was activated, but we needed to establish that it was, and at least look in our simplified model that the decorin pathway, and especially the phospho-PDGF, are through MAP kinase, that's the pathway that we should be targeting, or that we could be targeting going forward.